Hello everyone. Today we're talking about a topic that touches so many lives but is often discussed in whispers: infertility. What does it really mean? Simply put, infertility is when a couple has not been able to get pregnant after 1 year of trying. For women over 35, we often look at this after 6 months of trying. It's not about blame and it's not a personal failure. It is a medical condition, just like any other. This journey can feel long and lonely, but understanding it is the first powerful step toward finding solutions and taking control of your health. One of the biggest myths we need to bust right now is that infertility is solely a woman's problem. That could not be further from the truth. Infertility is a team issue, not an individual one. Think of it like this. About 1/3 of cases are due to factors with the woman, 1/3 are due to factors with the man, and the final third are a combination of both partners or have no clear explanation. It takes two to make a baby, and it can take two to uncover why it's not happening yet. So it is absolutely essential that both partners are part of the conversation and the solution. Facing this challenge together can strengthen your bond as a couple. It's a time to lean on each other for support, to communicate openly about your feelings, and to approach every doctor's visit as a unified team. Remember, you are in this together, every step of the way. This shared path is not just about medical tests and treatments. It's about navigating hopes and disappointments side by side. Your partnership is your greatest strength, and tackling this journey with love and mutual respect will make all the difference in the world. So, let's start this conversation with compassion and clarity. We're going to peel back the layers of this complex issue, explore the causes, and shine a light on the incredible treatments and support systems available today. The goal is to empower you with knowledge. Knowledge gives you the power to ask the right questions, make informed decisions, and find the path that is right for you. You are not alone, and there is so much hope on the horizon. Let's dive in and learn together. Let's talk about what can cause infertility in women. The female reproductive system is a beautifully complex machine, but sometimes a part of it isn't working as it should. One of the most common reasons is a problem with ovulation, which is when the ovary releases an egg. If no egg is released, pregnancy simply cannot happen. Conditions like polycystic ovary syndrome, or PCOS, can disrupt the hormones that trigger ovulation. Other issues can include blocked fallopian tubes, which are the pathways the egg travels to meet the sperm. If these tubes are blocked, the egg and sperm can't meet. Beyond ovulation and tubes, the uterus itself can play a role. The uterus needs to be a healthy and welcoming place for a fertilized egg to implant and grow. Sometimes there are issues with the shape of the uterus, or there might be growths like fibroids that can interfere with implantation. Another important condition to know about is endometriosis. This is when tissue similar to the lining of the uterus grows outside of it, which can cause inflammation, scarring, and blockages. Lastly, age is a significant factor. A woman is born with all the eggs she will ever have, and as she gets older, the quantity and quality of those eggs decline. Now let's turn our attention to the men. Male infertility is just as common, and the causes are just as varied. A primary factor is the sperm itself. This can mean a low sperm count, which is when there are fewer sperm than normal in the semen. It can also be about sperm quality, which includes motility, how well the sperm swim, and morphology, or their shape. If sperm can't swim properly or are not shaped correctly, they will have a very hard time reaching and fertilizing the egg. These issues can be traced back to a variety of underlying causes. What causes these sperm issues? It can be a number of things. Sometimes there are blockages in the tubes that carry sperm, similar to blocked fallopian tubes in women. These blockages can prevent sperm from getting out. Hormonal imbalances can also play a major role, affecting the body's ability to produce healthy sperm. Lifestyle choices matter too. Things like smoking, excessive alcohol use, and poor diet can all negatively impact sperm health. In some cases, the cause is genetic. It's a complex picture with many potential factors to investigate and address. So, how do doctors figure out what's going on? The diagnostic journey begins with a conversation and some straightforward tests for both partners. It starts with a thorough physical exam and a detailed medical history. Your doctor will ask about your lifestyle, health history, and how long you've been trying to conceive. For the woman, initial tests often involve blood work to check hormone levels and confirm if ovulation is occurring. An ultrasound might also be used to get a good look at the uterus and ovaries, checking for things like fibroids or cysts. For the man, The cornerstone of diagnosis is a semen analysis. This simple, non-invasive test provides a wealth of information. It measures the number of sperm, their shape, and how well they move. It's a critical first step that can quickly point doctors in the right direction. If these initial tests don't reveal a clear cause, your doctor might suggest more advanced diagnostics. For women, this could include a procedure to check if the fallopian tubes are open. For men, it might involve further hormone testing or an ultrasound to look for blockages. Once a cause is identified, we can talk about treatments. The good news is that there are many effective options available. For women with ovulation problems, medications are often the first line of defense. These drugs can help stimulate the ovaries to release an egg, giving you a chance to conceive naturally. If there are structural issues like blocked tubes or fibroids, surgery may be an option to correct the problem. Each treatment plan is tailored to the specific cause of infertility, which is why a proper diagnosis is so important. For men, treatments also target the underlying cause. If a hormone imbalance is the issue, medication can help restore normal levels and improve sperm production. If a blockage is found, surgery can sometimes repair it. Lifestyle changes are also powerful tools. Improving diet, exercising, quitting smoking, and reducing alcohol can have a significant positive impact on sperm quality. Sometimes the best approach is to combine these treatments with assisted reproductive technologies, which open up a whole new world of possibilities for building your family. When treatments for specific causes aren't enough, or if no clear cause is found, a situation we call unexplained infertility, we turn to assisted reproductive technology, or RT. You've likely heard of these options. One of the most common is intrauterine insemination, or IUI, where healthy sperm is collected and placed directly into the woman's uterus around the time of ovulation. This gives the sperm a head start and increases the chances of it reaching the egg. It's a less invasive and more affordable option that helps many couples. The most well-known ART procedure is in vitro fertilization, or IVF. This is a multi-step process where eggs are retrieved from the ovaries and fertilized with sperm in a lab. The resulting embryos are then allowed to grow for a few days before one or more are transferred into the uterus. IVF can overcome many barriers, from blocked tubes to severe male infertility. It has helped millions of people around the world become parents. These technologies represent incredible medical advancements, offering hope when other paths have been exhausted. They are powerful tools on the journey to parenthood. It is so important to acknowledge that infertility is more than just a physical condition. It is an emotional marathon. The cycle of hope and disappointment each month can be incredibly draining. It can strain relationships, cause feelings of stress, anxiety, and even isolation. You might feel like no one understands what you're going through. Please know that these feelings are normal and valid. It is crucial to take care of your emotional well-being during this time. Find healthy ways to cope with stress, whether it's through exercise, meditation, or a hobby you love. Remember, you are not alone on this journey. Infertility is common, affecting 1 in 6 couples. There is a strong community of people who have walked this path and understand your struggle. Seek out support. This could be a professional counselor who specializes in infertility, a support group, or even talking openly with trusted friends and family. Sharing your story can lift a heavy weight off your shoulders. There are so many paths to building a family, and with the right support and medical guidance, there is always a reason to hold on to hope.